In today's podcast, we have a great show today where we're talking with Dr. Christopher Rose, a sleep expert, one of the only sleep experts in the area. We talked about what causes bad sleep, what are some of the habits we recommend. We talk about the best tip you can do to improve your sleep and the most common myths. So if you've had any issues with sleep or you know somebody who has, this is the podcast to watch and listen. So stay tuned. Dr. Rose, thank you for being on our podcast. Tell our audience who you are, what you do, and kind of what your specialty is.
Well, my name is Christopher Rose. I am a sleep specialist here in Lubbock, Texas. I started out many years ago as a respiratory therapist and then went to medical school and then became a family medicine doctor. And I did family and sleep for a period of time and recently retired from family, and I'm just doing a full-time sleep medicine practice right now.
Well, so what made you transition mainly into sleep? Like, what was that interest? What piqued that? Kind of what led to that discovery of you enjoying sleep?
So I actually built the first sleep lab in Lubbock, Texas.
Oh, wow.
Back in the 1980s as a respiratory therapist. One of the pulmonologists came to our office and said, "We need a sleep lab." And we were like, "What is a sleep lab?" And so me and my boss did the research on what a sleep lab was, what equipment we needed, what setup we needed. And so we built a 2-bed sleep lab at what was St. Mary's Hospital.
Yeah.
And started doing sleep. And my boss was like, "Well, you want to work it?" And I'm like, "No, that's a night shift job. I've done enough night shifts in my career. I'm on a day shift job." I was running the pulmonary lab at the time.
Yeah.
And I didn't take that job.
Yeah.
And then years later, when I got out of residency and started my family medicine practice, one of my buddies from back then came and said, "You need to start reading sleep studies."
Yeah.
And I started reading sleep studies at that time and started seeing sleep patients at that time. I studied and took the board exam for sleep and started doing sleep. And in doing that, as a family medicine doctor, I was doing adult and pediatric sleep. And I really enjoy pediatric sleep, but I do a full service sleep clinic. And I was the only one, and even today, I'm still the only one in the region that does pediatric sleep.
Wow. And so it feels like everyone has a sleep problem. I mean, literally everyone who I talk to says they don't sleep well, they have difficulty sleeping, they don't have good quality of sleep. A, have you noticed just more people are just having sleep issues? And B, why is that the case? Like, what is going on?
Well, there's a lot of reasons why people have sleep problems and why it's a growing thing. Number one is the obesity epidemic and people getting larger and more people developing sleep apnea, and I see a lot of that, and that has been increasing over the years. The other one is the advent of technology and computers and light everywhere, and people don't have to be on a schedule, and so they stay up late watching TV or they stay up late playing on the phone or whatever they do, and their schedule gets out of whack, and that causes insomnia.
Now, do you feel like with the rise of social media and iPhone and more and more people getting on the phone, have you noticed just a wave of more sleep issues as people are doing that more? And secondly, have you noticed younger people having more sleep issues because of that same problem as well?
Absolutely. So with the technology, I see it in older and younger, but it's really bad in the younger people as they're growing up as babies and mom hands them a phone to play with to kind of keep them calm and quiet. And they grow up with that, and they have problems with sleep. A lot more pediatric sleep problems than there used to be. But I do see it in older people too. Even people in their 70s and 80s will be staying up at night playing games or watching blogs and things like that.
Yeah.
Just don't do it at night. It's okay to watch blogs, just don't do it at night.
Yeah.
But they did have a study once on adolescent females, so teenagers and early college age females, women. And they looked at the amount of screen time they had in a day and compared that to how fragmented their sleep was at night. And there was a direct correlation with the amount of screen time you have in a day compared to how poor your sleep was at night.
So during the day?
Yes, during the day.
Oh, wow.
And with today's society, kids are going to school and they're on a computer the whole time they're at school.
Yeah.
And then they come home and they're doing this with their video games or they're watching their phone or doing stuff like that. And so they just get a huge amount of that during the day. And so I see a lot of pediatric, adolescent, middle-aged and older people with insomnia problems.
Now you mentioned light. How does the role of light play when it comes to interrupting sleep or difficulty sleep? Is it we just have too much light on at night? Do we not have the room dark enough before we go to bed? Like, what's the interaction with that?
So light is what we call a Zeitgeber, okay? And that's a German word for time giver.
Oh, okay.
And light sets your circadian rhythm, okay? It's not the strongest thing that sets your circadian rhythm, but it is one of the things that sets your circadian rhythm. Everybody knows bright light keeps you awake, and dim light helps you sleep.
Yeah.
And it's typically any light that does it, with blue light being the strongest, okay?
Okay.
And all video screens, all LEDs, all phones produce a huge amount of blue light.
Yeah.
And blue light is the strongest. It biochemically, doctor to doctor, blue light hits the retina of the eye. Actually, light hits the retina of the eye. It produces a chemical called melanopsin. Melanopsin goes to the pineal gland in the brain. That's what produces melatonin. Melanopsin turns off the pineal gland. So your body stops making melatonin in response to light.
And so for our audience, melatonin is exactly, what does melatonin do?
So melatonin helps set your circadian rhythm. Okay, so it's a Zeitgeber also. There are many, like I say, many different Zeitgebers, and melatonin is the second strongest Zeitgeber.
Yeah.
That when the light goes down, so typically before we had phones, before we had light bulbs, before we had that, when the sun went down, the body started making melatonin, and that was the cue to start getting ready for bed and go to bed.
Yeah. So a lot of people may not realize that sleep can affect a lot of different aspects of their life besides just feeling tired. And so what are some of the things that you've noticed in individuals, besides just being sleepy, that lack of sleep or poor sleep can affect in terms of their everyday life?
Oh, it affects cognition, your ability to concentrate. In smaller children, they can get ADD symptoms. And so they'll get hyperactive and start running around if they're sleep deprived.
Yeah.
Adults tend to get more groggy and sleepy. There are many incidents in recorded history of people having sleep deprivation and that causing industrial accidents, such as the, kind of a mix with the Exxon Valdez back in the 70s or 80s, whenever that was. They were drunk and ran aground, but they were all sleep deprived. They were running on 16-hour shifts. So they would work 16 hours and then be off and then do whatever they want to do and then take a nap, and they were all sleep deprived.
Yeah.
That's been shown. The Bhopal, India disaster was all based on sleep.
Yeah.
And so there's been huge industrial accidents associated with sleep deprivation and not getting enough sleep.
So, one of the repercussions of that obviously is that when people are tired or they just don't get enough sleep, they overcompensate by having caffeine, energy drinks, a lot of coffee, a lot of drinks, you use caffeine shots and boosts.
Right.
How does that play a role in the cycle of sleep? Whenever you're sleep deprived, you're tired, you take caffeine to kind of get that boost, but then are you kind of shortchanging yourself later on and hurting your sleep?
Absolutely. So caffeine, you'll get that boost, and when you drink a cup of coffee or you drink a Coke or something that has caffeine in it, you feel that boost for about an hour or so. But I've read different textbooks that have the half-life of caffeine anywhere from 5.5 to 7.5 hours. Yeah. And so if you drink something with caffeine at noon, at 12:30 you're at peak blood levels. Okay. 5.5 hours later, when about 6 p.m., you still have half that caffeine in your body. 5.5 hours later, when you're trying to go to bed, you still have a quarter of that caffeine in your body. Now, for most people, a quarter of that caffeine is okay, but you can imagine if you're drinking something at 2 or 3 or 5 or even 8 o'clock at night, that's interrupting your sleep. Yeah. And I do get patients that come in and say, well, I drink a pot of coffee before I go to bed and it doesn't bother my sleep. Yes, it does. Yeah. If I were going to put you on a brainwaves, check your brainwaves, your sleep would be fragmented all night long if you did that. So
what is when you say fragmented, what exactly does that mean? Like what is the typical sleep pattern? What should it be? And what does it mean by having fragmented sleep?
So the typical sleep pattern comes in stages. The way I describe it is that like your Thanksgiving dinner and you're in your home and you eat this big Thanksgiving dinner and you're sitting there watching maybe a football game or something that you don't really have much play in. And so you're sitting there and you just kind of sit back and relax. When you first close your eyes and you get really relaxed, you can still hear things going around you, you can still hear the TV. That's stage 1 sleep. When it gets to the point where you no longer hear the TV, you're in a little bit deeper sleep, and that's stage 2 sleep. If I were to wake you up from stage 1 or stage 2 sleep, you would wake up pretty quickly and you'd be like, hey, wait a minute, I'm taking a nap here, leave me alone. Then you go into stage 3 sleep. Stage 3 sleep is the deepest of sleep, and it's the restorative sleep. This is where all the biochemistry happens in your body that restores your body, that restores your brain, it cleans out your brain, okay? If I wake you up from stage 3 sleep, you would be sleep drunk. You'd be groggy. You'd be, hey, why are you waking me up? I'm asleep here. Come on, I want to go back to sleep, okay? And then after stage 3, you go into REM sleep, a rapid eye movement sleep, and most people believe this is the deepest of sleeps, but it's not. It's actually a very light sleep. Your brain is actually in awake mode, and your body's paralyzed, so you don't move around, and you have your dreams. And you go through these stages through the night, typically 4 to 5 times a night. But in between these stages, you actually wake up. And you may not know you woke up, and you can wake up. I've seen people wake up out of bed, look around, then go back to sleep and not even realize they do it. Do it 7 or 8 times a night, not even realize they're doing it. Wow. If you drink caffeine, caffeine will interrupt that. You won't get as much stage 3 sleep. You probably won't get as much dream sleep, but you'll have micro arousals all throughout the night, waking you up, and you may not even know it's happening.
So with respect to caffeine, is there a certain amount of time with that half-life that you mentioned that you should stop drinking caffeine to help out with your sleep? Like, what would you give your recommendation just in general for somebody who's concerned about that?
On a regular schedule where people go into bed at 10 or 11 o'clock at night, I usually tell them to stop their caffeine and take it at noon.
At noon, okay, gotcha. And obviously if you go to bed earlier, you should kind of time that according to that.
According to that. Because like I say, the shortest I've seen is 5.5 hours. I've seen other textbooks say that the caffeine has a 7-hour half-life.
Okay.
So I usually go with the shortest, 5.5 hours. And at that point, if you drink something at noon and you're going to bed about 10 or 11 o'clock at night, you still have a little caffeine in your body, but probably not enough to affect your sleep.
Is that the same with decaf as well, or is it just, does decaf have some caffeine in it that may affect your sleep, or do we know
Most
about that?
decaf does have a little bit of caffeine in it, but you probably don't want to be drinking that right before bedtime. But.
Yeah. Now, a lot of people try to measure their sleep. They have apps, they have rings, they have different things like that. What are your thoughts on that? Is it helpful? Does it help you as a sleep expert to have that information?
So on the technology, I think it's not there yet. I think that 10 years from now, it will be there. Now, the technology for checking heart rate and the technology for checking, what we call actigraph, are you active at night, is very good. But the ones that tell you what stage sleep you're in, gosh, I really don't even know how they do that.
I don't know either.
We use brain waves in the sleep lab, and I don't know how a watch or a ring is going to be measuring brain waves.
Yeah.
I think they're using actigraph and assuming that if you're not moving around and the lights are off, that A, you're asleep, and depending on how much you're moving around, well, that's either dream sleep or not dream sleep. But they break it down into all 3 stages, and it's not going to be very accurate right now.
Yeah, so
maybe 10 years from now.
So in your opinion, there's really no point in, there's really not a good sleep reason to use these apps or these mechanisms. To
determine your stages, yeah.
Okay.
You could determine, like I said, we use what we call an actigraph. The beginnings of the smartwatch was actually the actigraph, which are motion sensors in a little watch-like thing. Yeah. And we use that to help determine sleep time. We use it to help determine basically when the lights are on and when the lights are off, circadian rhythms. We can determine whether or not you have an advanced phase or delayed phase, circadian rhythm, and different circadian disorders with the actigraph.
Right. Well, one of the things we asked our social media followers is the most common questions they have about sleep. So I think one thing that would be very interesting is for us to do a game here, true or false. So we can maybe go over some common myths, and you tell us as an audience, is this true? Is this false? Kind of what is the idea behind this? I was fascinated to hear some of these. So I'm excited about this. You ready?
Ready.
All right. So one comment I've seen is, you can catch up on sleep on the weekends. What are your thoughts about that? Because a lot of people do this. They sleep, 12 hours on the weekend, thinking they can catch up, but maybe sleep 6 hours, 5 hours during the weekday.
Yeah. Well, there's no catching up on sleep.
So what do you mean by that?
You're not going to eliminate the problems that you cause by having an inadequate sleep time or an inadequate sleep schedule by sleeping more on the weekend. You might get more sleep and you might feel better that day, but you're going to affect your circadian rhythm. So your long-term sleep cycle is going to suffer because of sleeping late on weekends. And when you try to go back to work on Monday, then you're going to be sleeping. So, for example, let's take the high school football player, okay? And he gets up in the morning and goes to school early in the morning, and then he goes to school, and then he goes to practice, then he comes home and eats dinner, and he goes to bed at an appropriate time.
Yeah.
Let's say 10:30 at night.
Yeah.
Gets up and does it the next day on Tuesday, does it on Wednesday, Thursday. On Friday, he has a football game.
Yeah.
Okay. Stays up real late at night. Maybe they're traveling 2 or 3 hours to get to their football game. They win or lose their football game, and they come back, and they stay up till 12 o'clock, 1 o'clock. So this is kind of the opposite of what you're talking about. And then, they get home, they're all excited because they won the game or whatever, or sad because they lost. And then they goes to bed, and he sleeps late that morning.
Yeah.
Well, the next night on Saturday, he's going to stay up and play video games or social media with his friends till 12, 1, 2 o'clock in the morning.
Yeah.
And then he's going to get up on Sunday morning, and his parents might wake him up and go to church, or they might let him sleep.
Yeah.
He's going to sleep till noon. Is he going to be able to fall asleep at 10 o'clock at night on Sunday so he can go to school the next day? The answer is no.
Yeah.
So he's going to be up at night. He's not going to be able to sleep.
Yeah.
He's going to get up on Monday morning. He's going to be groggy. He's not going to perform well in school. This will last 2 or 3 days before maybe Wednesday or Thursday comes around, and then the cycle all happens again.
Yeah.
So even though he slept later on Saturday and Sunday because he stayed up later, he might have a longer sleep time.
Yeah.
He's not getting any benefit from that. And then, like I said, the circadian rhythm, your body's clock, is being shifted around because of that. If you're going to bed at different times and waking up at different times, this is what you're doing to your schedule.
And so would it be best then, to be frank with you, is wake up and go to sleep at the same time every day?
Yes.
Okay.
So a strict schedule and getting up at the same time every day, which we can't always do because that guy's got to go to his football game.
Yeah.
But I talked a little bit about Zeitgebers earlier with melatonin and those. The strongest Zeitgeber, the thing that sets your body's clock, is the time you get out of bed every morning. So he would be best by staying up for the football game and doing all that, getting home, getting to bed as soon as he can, but then waking up at the same time on Saturday, going through his Saturday without a nap,
Yeah.
and then start doing the same thing on Sunday.
So you mentioned without a nap. So, a lot of people, I'll take me for example. I take a nap on the weekend just because I'm tired. I think, let me just catch up on my sleep. So in that scenario with a football player, they'll be getting up at the same time. Obviously, they'll be sleepy during that day because they didn't get enough sleep because they stayed up. Is a nap not the right thing to do, or what are your thoughts on that?
So I'm not against naps. I'm not the nap Nazi or anything like that, but I always tell my patients not to take naps because my patients come into my clinic and they're having a hard time sleeping at night.
Yeah.
So if you're having a hard time sleeping at night, you should probably not be taking naps.
Yeah.
If you can take a nap during the day and go to bed that night and not have any problems, wake up the next morning feeling refreshed.
Yeah.
There are many societies in the world that build a nap into their day. In Mexico, it's called the siesta. I believe in Greece, it's called the ristra. But typically when they do that, they take that 30-minute period of time or the hour period of time out of their nighttime sleep, and they do it every day.
Okay.
So it's not really messing with their circadian rhythm because it's something they do every day, all day, and they do.
Yeah.
If you're just a normal person, you don't have any problem sleeping, you don't have any daytime functioning problem, and you take an occasional nap, that's probably not a problem.
Yeah. Okay.
But if you're doing it trying to catch up, it's probably just messing your sleep up at night.
So instead of trying to catch up on the weekends, it's better to just keep that same wake up time.
Maintain the schedule.
Even if you can't sleep even though you can't sleep maybe as you normally do the night before,
Right.
still maintain that wake up time. It's probably more important.
Right.
Okay, that's really good. Another question: everyone needs 8 hours of sleep. Is that true or false? And what are your thoughts on that?
I'm calling that one false too.
Okay, tell us
Okay,
why.
Yeah. So there are people known as long sleepers and short sleepers. And in sleep medicine, we look at daytime functioning. And there are people who sleep 6 hours a night. They get up the next day, they feel fine, they're not sleepy during the day. They're businessmen or physicians or whatever they might be. They're functioning well, they don't have any problems, they're not having to do excessive caffeine intake, and they're doing fine. We have other people that if they don't get their 9 hours of sleep, then they're miserable the next day. And they're having to take a lot of caffeine. And so some people require 9, some people require 6. The average is 8. Okay, so if you look at people as a whole, that's an average. It's not what people require.
How would you know which spectrum you're in terms of 6, 7, 8? Is it how you feel whenever you get up, or how would someone know that? All right, I think I know where I'm at.
not necessarily how you feel immediately after getting up, because there's a thing called sleep inertia.
Yeah.
And hardly anybody wakes up going, ta-da, I'm awake, I'm going to go off about my day. You wake up and you're like, oh, yeah, wow. And you have to get up, and you have to turn the lights on,
Yeah.
maybe have a sip of coffee or something like that, and then you wake up.
Yeah.
That sleep inertia can last longer or otherwise. So if you're having an extended period of sleep inertia, or if you're having to take a lot of caffeine to maintain your day and to be able to function during the day, and you feel sleepy during the day, you may not be getting enough sleep.
Okay. Now, kind of along the same lines, I've heard of people who are more night owls, early morning people, and that you should try to tailor your sleep towards your kind of natural chronicity with respect to that. Do you have any thoughts on that? Like, should we all be going to bed at 10 o'clock at night? Should those of us who have, early jobs but we're night owls, quote unquote, do we try to change our job to accommodate our sleep? Like, how does that play a role in terms of your natural inclination for who you are as a person?
So as you're growing up and getting into your field of choice, many times people will pick your field of choice because of their sleep.
Yeah.
I mean, there's plenty of people out there that work evening shift or night shift, and they're the night owls.
Yeah.
And they do fine throughout the day.
Yeah.
Other people are morning larks, and those are the people that wake up early. But once again, we look at daytime functioning, okay? If you're having a difficulty functioning in the day because you're staying up late at night and you have to get up in the morning, society sometimes sets our schedule.
Yes.
Okay. If you want to be a banker, you're not going to be a night owl very good.
Right.
And so, or you're not going to be a banker very good.
Yes, exactly right.
And so society typically sets it, and typically, the normal, I guess the average person in the United States does have a daytime job, and they work at, they go to bed at 10:30, 11 o'clock. But there are people who just genetically predisposed to be night owls and genetically predisposed to be morning larks.
Yeah.
But there's also a thing called circadian rhythm disorders.
Yeah.
And so if you imagine your circadian rhythm sitting like this, a normal person with a normal society and all that stuff, if your circadian rhythm is shifted more towards the night, we call that a delayed phase circadian rhythm.
Yeah.
Okay. So you can have a delayed phase circadian rhythm and you're just a night owl.
Yeah.
But if it becomes a problem in your daytime functioning, that is now called a delayed phase circadian rhythm disorder.
Yeah.
Okay. If it's advanced the other day, where you're going to bed at 6 o'clock or 8 o'clock, and you're waking up at 2 or 4 o'clock in the morning, that's called an advanced phase circadian rhythm disorder.
Yeah.
Okay. But it's only a disorder if it's messing with your daytime function.
Okay. Because otherwise, if you're fine, you're
just a morning lark.
That's who you are.
Owl.
Okay. That's great to know. Perfect. Exercise at night ruins your sleep. What are your thoughts on that?
So that is something that was taught many years ago, and exercise ruins your sleep, and it's horrible, and you shouldn't do it, but it is a myth.
It's a myth. Okay.
It's false.
Yes.
Yeah. So we know now that people can exercise up until about an hour before they go to bed. Now, this is going to be individual for the individual. They'll have to figure this out. But typically, we look at about an hour before bed, and you can do exercise up until then. But an hour before bed, you do need to stop exercise. So if you're exercising right before you go to bed, exercise gives you energy and wakes you up.
Yeah.
And so you don't want that. It also warms the body.
Yeah.
Okay. A normal person on a normal schedule who doesn't have any problem sleeping at all, okay, they go to bed at a certain time, their body starts to cool down, and the core temperature of the body cools down all the way until about an hour before they wake up. An hour before you wake up, your body's core temperature starts to rise. It's that rise in core temperature that tells you to wake up. It's a Zeitgeber.
Oh, okay. Yeah.
Okay. It's the falling core temperature that tells you it's time to get ready for bed. It's a Zeitgeber. So if you exercise up until about an hour before you go to bed, your body's warm, but as soon as you stop, your body starts cooling down, and it starts that cooling trend.
Yeah.
So actually exercising up until an hour before you go to bed can be beneficial for your sleep quality. But if you take it past that, then when you're trying to go to bed, your core temperature is high, and that's going to prevent you from falling asleep, and it'll worsen your nighttime quality.
Oh, that's fascinating, because I've been told this by so many people, so many friends, so many doctors, hey, don't exercise at night because it affects your sleep. But I'm glad I'm listening to the expert who tells me the actual truth there. We talked about this briefly, but let's maybe hone in a little bit more. Blue light from screens is one of the main issues when it comes to sleep problems.
I think it's becoming one.
Okay.
Yeah. And as more and more we're tied to technology and stuff like that, like the kids in school that we talked about earlier on their computers all day long, and moms handing the phones to the babies and saying, here, be quiet, I don't want to mess with you, you know, that kind of thing. That we get tuned to having this in front of us.
Yeah.
And once again, any light does it, but the blue light is the strongest light that does it. And so all LEDs, whether it be a phone, whether it be a TV, whether it be a computer or a tablet, produce blue light. And some computers have little settings that you can set that turn the blue light down, or you can buy these blue light goggles. There's at least 3 studies that I've read on blue light goggles saying they don't work at all. And I've seen at least 2 studies on those settings that you put on your computer. You cannot have an LED without blue light.
Yeah.
And it's blue light, all light does it. It's the blue light that suppresses that melanopsin in the retina stronger than anything else.
So is there a point in time when you would say you should turn off the blue lights before you go to bed?
About an hour before bedtime, shut off all your lights.
Okay. Does that also include television, or is that
television? Anything that has an LED.
Okay.
Probably want to turn down any lights as dim as you can. I usually tell my patients turn off all screens, and then turn your lights down dim. And then, if you take melatonin, this is the time to take it too, because melatonin is a Zeitgeber, and you want to take it same time every night.
So talk to us about melatonin, because a lot of people use melatonin. People have different reactions. It works, it doesn't work. What is your thought on melatonin in terms of helping out with sleep?
So in some people, melatonin can be sedative, but it has to be a 5 or 10 milligram dose.
Okay.
Typically more than that. It doesn't work any better than 10 milligrams.
Okay.
I don't usually use it as a sedative, but the 3 milligram or 2 milligram dose, depending on age, is, once again, it's a Zeitgeber. And you have to take it at the same time every night, about an hour before bedtime. And that sets your body's clock. So the 2 things that set your body's clock the strongest are the time you get out of bed in the morning and the time that your body starts making melatonin. And what I use it for in my clinic is to augment what we call DLMO, or dim light melatonin onset, which happens about an hour before bedtime. So you take it at the same time that your body should be producing melatonin.
Yeah. Now, there are other supplements that people have tried in terms of helping out with sleep. I've heard magnesium and other things as well. Do you have a thought on, are those things that actually you feel like help out with the sleep quality, helping out with sleep, or are they mainly things that people have not really found a lot of good evidence? There's not a lot of good evidence for that.
To some degree, there's some placebo effect.
Yeah.
To some degree, magnesium works because it's a smooth muscle relaxant. So it's almost like a mild muscle relaxer, but you can't take too much because milk of magnesia is a magnesium. And you might have the runs all night long. Most of that stuff has very limited data. And when they do have data on it, it's a little sketchy. It's kind of like, it helps some people, it doesn't help other people.
That makes sense. Now, people think that whenever they have difficulty sleeping, it's sometimes they assume it's the difficulty to fall asleep. But there are a certain number of people who can fall asleep fine, but they wake up in the middle of the night. They can't go back to sleep. Is that a problem, and how does one address that particular problem?
So insomnia is defined as having difficulty initiating sleep or difficulty maintaining sleep. And so there's many different kinds of insomnia, but the base definition of insomnia is difficulty sleeping, whether it's getting to sleep or staying asleep. Some people actually have what we call early morning awakenings, especially people who drink a lot of alcohol. Will wake up at like 4 o'clock in the morning every day. And then they can't get back to sleep. And the interesting thing about that with alcohol is that can persist for years after you stop drinking alcohol.
Wow.
And that's called an early morning awakening. But you also have the people who can't get to sleep, and you have people who can get to sleep just fine, but they wake up every 2 hours, and when they wake up, they can't get back to sleep.
Is the treatment for both those types of insomnia the same? Is similar recommendations for both, or are they different?
So if you look at the textbooks, if you look at all the tests that doctors take, the answer to that is yes, it's cognitive behavioral therapy for insomnia. But we do use medications for insomnia. I try not to use them for long term, just short term to help you get on a schedule and get going. And I use different medications for each of those different types of insomnia.
So you mentioned cognitive behavioral therapy. Can you maybe explain to our audience how that, what exactly is that when it comes to sleep? Like what are some techniques with that?
So cognitive behavioral therapy in itself is something that a psychologist typically does. And it's an 8-week program. And each week they do something different, but it includes schedules. schedule is a psychological therapy for insomnia because it has the two strongest zeitgebers built into it, the time you go to bed and the time that you wake up in the morning. So schedules, bedtime routines. So doing the same thing over and over and over again. So I don't know, do you have any animals, any cats, dogs?
Oh, we have 5 cats now.
5 cats.
Yes.
If you watch them very closely, whether it be a cat or a dog or otherwise, they'll do the same thing every night before they go to bed. I used to have a potbelly pig, and he would come in his little piggy door when the sun hit a certain area of the sky, so that the light triggered him to come in the house. He would circle his bed 3 times. He would scratch on the ground 5 times. He would circle his bed 3 more times. Then he would walk about 5 feet over to the wall and scratch on the wall 5 times.
Yeah.
Then he would come back and he would circle his bed a final 3 times before he laid down and go to bed. He did that every night of his life.
Yeah.
And he lived to be about 20 years old.
Yeah.
Those behaviors told his brain that it was time to go to bed.
Yeah.
So that we call that a sleep routine. So cognitive behavioral therapy, you have schedules, sleep routines.
Yeah.
They'll use biofeedback. They'll use sleep deprivation therapy. And there's some other therapies they use, such as a stimulus control therapy.
Yeah.
Don't do anything in your bed other than sleep.
Yeah. Yeah.
Because if you read in bed or watch TV in bed or toss and turn in bed wondering why you can't sleep, your brain associates your bed with where you toss and turn and can't sleep.
Yeah. So if you could describe the optimal routine for sleep and say, hey, these are the things that would best give you probably the best techniques to help you sleep, like what would that be? Like, you mentioned things about not having caffeine in the afternoon, turning down the lights, not exercising an hour before, but what would be kind of the steps you'd recommend to somebody who's, hey, I feel like I have sleep issues, I don't know what to do, what are some recommendations, some steps you'd recommend?
That's always the same.
Yeah.
So yeah, stop caffeine at noon, or depending on your schedule, I'll make that different. So if they want to get up at 2 o'clock or go to bed at 12 o'clock at night, I'll make it maybe 1 o'clock.
Yeah.
But stop caffeine at least 7 or 8 hours before you go to bed. And turn off the lights about an hour before you go to bed. If you take melatonin, this is the time to take it. Okay. Turn the lights down dim to where you're not bumping into walls, but not to where you have all this bright light around you. Get ready for bed. Maybe take a 5-minute hot shower. Okay. 5-minute hot shower will warm your surface, but it won't warm your core temperature. And when you get out of the shower, that evaporation starts the cooling trend.
Yeah. Okay.
Okay. And then get ready for bed, brush your teeth, get your jammies on, fix the coffee for the morning, whatever you normally do, get ready for bed. And then if you have any time from that time to the time you actually go to bed, find a place in your house that you can sit in a regular chair, upright, with a 30-watt lamp behind you and read a book, read a magazine.
So not in bed?
Not in bed.
Yeah.
Read the Bible. This is going to be your happy place.
Okay.
This is what I call the happy place.
Yeah.
And you're going to read something. If you don't like reading, do crochet or something like that.
Yeah.
But typically read something or do something kind of mindless.
Yeah.
And then when your bedtime comes, go to bed.
Okay.
Okay. If you have problems getting to sleep or staying asleep, don't stay in bed. Don't sit there tossing and turning. Get out of bed. Go to your happy place. Read or do whatever you do.
Yeah.
Okay. Then when you're sleepy, go back to bed.
Yeah.
But you're going to get out of bed at the same time tomorrow morning.
So
regardless of how much you slept,
yeah,
you're going to get out, or how much you were reading, or you're going to get out of bed.
Yeah.
It's really a pain in the butt for the first week.
Yeah.
But it levels out over time, and you'll find that even after about a week or so, 2 weeks, your sleep quality will improve, your daytime functioning will improve.
Okay. Wow.
I've proven that over and over and over again with my patients.
Yeah. So
it's amazing when I have students or other people watch this and they see a patient come in and say, "Doc, I did everything you did, and I'm cured." Or, I'm significantly better. When I put an insomniac on a schedule, and tell them the routines to do and stuff like that, if they actually do it, 65% will come back and tell me that they are significantly better, and probably about 40% will come back and say they're cured.
Wow, that's amazing. So just so we can summarize for our audience, so getting up at the same time every day no matter what, stopping caffeine at least 7 or 8 hours before your quote-unquote bedtime, have that routine down for going to bed, dim the lights an hour before. If you take melatonin, take it at that time. Take a 5-minute hot shower, get your routine done, go to your happy place, sit down, have a 30-watt light bulb behind you, read, crochet, do whatever you need to. When you go to bed at that time. If you toss and turn, get up, go to your happy place. But just maintain that schedule no matter what. No matter how your sleep is, and eventually you'll get to a point in time where you're doing okay.
Most of my patients tell me it's typically by the end of week 2 they've noticed a difference in their sleep quality and their daytime functioning.
So people should not give up if like the first couple of days, like, oh, this is not working.
Oh, they should not, because it's very difficult to do
Yes.
that. It's very difficult. I tell my patients when I put them on a schedule and I give them those routines, like, this will be hard.
Yeah.
Probably 90% of patients come back and tell me that first week sucked.
Yeah. Now, what is the role of eating in sleep? So, there's some thoughts that, you should wait a couple hours before you sleep. Maybe you shouldn't eat certain foods, or you should eat certain foods to help you sleep. Do you have any thoughts on that?
Well, you can't sleep if you're hungry.
Mm-hmm.
So a light, healthy snack is probably okay right before bedtime.
Mm-hmm.
But you can't fall asleep if you just had Thanksgiving dinner and you're so full you can't even roll around.
Yeah.
And plus there's other biochemical things that happen in the body, as you know, as a digestive specialist, that they'll take blood out of areas where you don't need it to take blood out of. So light snack before bedtime is probably fine, not a big heavy thing. As far as certain foods, everybody talks about turkey and things like that have tryptophan in it.
Yeah.
Tryptophan is a precursor for melatonin,
Yeah.
but you're going to have to eat a whole turkey to get enough tryptophan, and that's probably not good.
That's why not. No, I agree. That's not a good idea, I think, for
And,
anybody.
I wouldn't eat something with a lot of sugar. Definitely don't eat anything with caffeine or anything like that in it. You probably don't want something really heavy and fatty. Just a light, healthy snack.
Perfect. That sounds great. So other options for sleep. Some people do need medical therapy for sleep. They need medications to help out for whatever reason. What are your thoughts on that? Are there ones that work, ones that don't work? Or how do medications play a role in terms of your practice for helping out with people with sleep issues?
So in my practice, I do have people are sending people to me, physicians, primary care doctors and stuff are sending people to my clinic with insomnia, and they've tried different medications. My take on medications is, it doesn't matter what medicine it is, if you're not doing the schedules and the routines, it'll only work for a short period of time. Okay, so I always put that into play first.
Yeah.
And I hardly ever prescribe something the first time you walk in my door. If later on down the road you're doing those things and you're still having a problem getting to sleep or staying asleep, then I will use medications. I use a variety of medications, but there are some that I shy away from. The ones that I shy away from the most are the drugs like Ambien or
Interesting, Ambien.
what we call the Z drugs.
Yeah, a lot of people use Ambien,
Zolpidem, Azopiclone,
Yeah.
and Zolefalon.
Yeah.
We call them Z drugs. And the reason is because they work so well. But the longer you take them, the less they work.
Oh.
But when you stop them, you get a rebound insomnia that's worse than your original insomnia. So you think, well, gosh, it must have been working.
Yeah.
And so you don't get addicted to them. You don't get DTs. You won't have a seizure if you stop taking them. You'll just have this really horrible insomnia that lasts about 2 weeks. And then you'll be back where you were without the medicine. And that's the hardest thing to do, is to get people to stop taking Ambien and those drugs.
Yeah. Wow. Because a lot of people are on Ambien, like a lot.
Yeah. Some doctors use pregabalin and gabapentin, which is used for a lot of different things. It's not, it's an interesting medication. I do use it some, depending on if you're having pain, and that's one of your problems when you're having sleep. But those are interesting medications because they're one of the only medications that actually increase stage 3 sleep, which is the restorative sleep.
Yeah.
And there's a lot of research going in right now. What can we do to get people more stage 3 sleep? And that is one of them. That's why I use it a little bit.
Okay.
Typically when I do use a medicine, I try to customize it to the person. What reason, why are you having a hard time sleeping? What are your problems sleeping? And I'll pick the medicine that I think is best for that particular situation. I will tell the patient, we're only going to use this for a short period of time so that you can get on that schedule and stay on that schedule and work with that, because that's the treatment for insomnia, that cognitive behavioral therapy, or sleep scheduling and all those things we talked about.
Yeah, I mean, it's you're right. It's the basics. If you don't do the basics, no amount of medication is going to fix that.
Right. I get patients all the time, and it's like, Doc, I have this insomnia, and it's horrible, and my primary care doctor put me on this medicine and that medicine. Each of the medicines worked for a short period of time, but then after about 2 months, 3 months, they were either asking for a higher dose or a change in medicine. No medicine will work long term if you're not doing the things that you need to do to help with your insomnia.
Wow. So you mentioned the importance of having a schedule, which I think makes a lot of sense. There are some patients who have, a shift work where, during the work week, they have to get up early, like at 2 or 3 in the morning, because they have early, the way the work is. But on the weekends, when they have time to, relax and to be around their family, it's hard for them to get up that early on the weekends because
they shift their schedule for weekends.
Exactly.
versus night.
So is your, I'm gonna put words in your mouth, but I'm assuming your recommendation would still be to maintain that same schedule even on the weekends.
Yeah. So some people work night shift,
Yeah.
some people work evening shift, some people work day shift. If you look at health and the effect of shift on your health, the second worst shift is night shift. And a lot of it is because people are shifting their sleep. They tend to have more heart attacks and more health issues and more health problems than people who work day shift. Then comes evening shift. Then comes day shift, which is the healthiest. But the worst is people who do what we call split shift, what I call split shift. So some industries, and I don't know why an industry would do this to somebody, you'll work 2 weeks of day shift, 12 hours, and then you'll have some time off. And then you'll work 2 weeks of night shift.
Yeah.
And then back to day shift and back to night shift. Those people are the people who have more heart attacks and more strokes than any other shift.
Yeah.
Excuse me. And people who work night shift, who are shifting their weekend days or their off days to a day shift, are doing a split shift.
Oh, okay. So so they're doing, yeah, you're right. They're doing kind of mini shifts within a week.
Mm-hmm.
And from your opinion, obviously, not only do they have worse health problems, but they can't get, I mean, they just can't get sleep.
They'll never get their circadian rhythm set.
Yeah.
And then, like I say, worse health problems, all around, all kinds of things.
So for those individuals who are in those shift work, it's better for them to keep those same schedules even on the weekends, even though it may be a pain for the, whatever, but you'll live longer, live better.
Right.
Okay. That's
Or at least try to stay on that schedule as much as you can.
Much as you can,
Shift it a little bit, but don't shift it a whole
bunch.
12
Okay.
hours,
Okay. So another myth is snoring is harmless. I just snore, not a big deal. What are your thoughts on that?
So some mild snoring might be harmless, and snoring is really only a symptom.
Mm-hmm.
So snoring might be a symptom that you have obstructive sleep apnea. But even above and beyond that, we know that people who really snore heavily, it fragments their sleep. And that can make their sleep quality worse, making their daytime functioning worse. But then you take it down another level, and that could be a symptom of what we call sleep apnea. Sleep apnea is where you stop breathing at night, okay? And if I were to reach over and grab you by the throat right now and choke you,
Mm-hmm.
you'd get excited.
Yeah.
Your body would produce adrenaline.
Yeah.
Your heart rate would start beating faster. Your blood vessels would shrink up and your blood pressure would go up, okay? You release cortisol, which is a stress hormone. Your body would be stressed, okay? Increases your risk of heart attack and stroke if you do that all the time, and that's what sleep apnea does. So like the sleep apnea fairy sneaks into your room and grabs you by the throat in your sleep. You can't breathe and you struggle to breathe. And then you have oxygen levels drop, your carbon dioxide levels go up, and you have a micro awakening. So you'll hear this, and then it'll get quiet, and all of a sudden they go. That was them waking up. They had a sleep apnea event. Their blood pressure went up, their heart rate went up, their blood vessels shrank down. Sleep apnea can increase your risk of heart attack and stroke and funny heartbeats like atrial fibrillation 2 to 3 times.
Wow.
I mean, we're at risk because we're men
Yeah.
and we're human and our age, and we can't do anything about that risk. But if you double or triple that because you have sleep apnea,
Yeah.
you're at risk for those things. And it's all because of the stress on your body and the stress on your heart.
So 2 questions with that. So number 1, sometimes if we have it ourselves, we don't notice it. So is this something that a spouse or a loved one can sense if they're doing that? And then secondly, if you get a patient who tells you, hey, my wife tells me I do this, what is the next step for them in terms of how do you manage that?
So first of all, I think a lot of people know they have sleep apnea and they just kind of ignore it.
I think you're right. Yes.
But you would have daytime functioning problems. So
Okay.
you'd be sleepy during the day, maybe a little excessive sleep inertia, wanting to take naps in the day. Maybe you're driving a truck and you're veering off on the road and stuff like that. When I see a patient with sleep apnea, I document a lot of things because I realize that the more I document, the less refusals I get from insurance companies to do the things that I want to do.
Yeah.
But basically, snoring, witnessed apneas, blood pressure that's uncontrolled. If you're on 3 or more blood pressure medicines and your blood pressure is still uncontrolled, there's an 85% chance that you have sleep apnea.
Wow.
Okay, and a witnessed apnea is also the second. Also 85% chance. So if your spouse tells you you stop breathing at night, there's an 85% chance she's right.
And if that is the case, what do you do as a sleep doctor for the next step? Is that what a sleep
So
study
I
is?
document all the things that will get an insurance company to allow me to do a sleep study.
And what exactly is the sleep study?
A sleep study is called a polysomnogram, which means mini sleep graphs. But it's basically we let you sleep We can do it in a lab. We can do it in your home. The home ones aren't as good as the ones in the lab. We look for more stuff in the lab. So if we need something really more in-depth, we'll do it in the lab. And we let you fall asleep, and we have you connected. We measure your breathing. We measure your heart rate. We measure your airflow. We look at brain waves in the lab. We can look at limb movements, whether you grind your teeth, stuff like that. But it's basically looking for things such as sleep apnea. And that is the indication, probably one of the only indications for doing a sleep study is if you think you have sleep apnea.
Okay.
Once we get a positive result on that sleep study, it depends on how severe it is, what the treatment of choice is.
Yeah.
So depending mild, moderate, or severe, the treatment of choice is always what we call continuous positive airway pressure, or CPAP. Mm-hmm. And many people are familiar with that because grandpa has one, or dad has one, or somebody has one. But in mild to moderate, we have other treatments too that we can use if for some reason they can't use CPAP or don't want to use CPAP or stuff like that. When you get into the severe realm, there's very little more that works. And the best way I can describe what CPAP is, and the way I do describe it to patients is, because they always come in, I got to wear a Darth Vader mask? No, not Darth Vader, jet fighter pilot. Because really, CPAP is nothing more than what a jet fighter pilot wears when he's flying around in the cockpit.
Mm. And so does weight loss help out then with sleep apnea?
I always tell my patients your best chance of cure is weight loss.
Weight loss, okay.
So when the weight loss surgeons do their weight loss surgery,
Yeah.
if they think the patient has sleep apnea, they'll do a sleep study before they do their surgery. We'll get them on a CPAP machine. We'll do the surgery. We'll wait till they get to their goal weight. And when they get to their goal weight, we'll retest them. 80% of them are cured.
Wow. Yeah.
20% are not.
Yeah.
There's more to it than just weight, but weight
Yeah.
is the biggest factor in sleep apnea.
Yeah, that makes sense. So we went through, I think, a lot of great tips for our patients, and I think this will help out a lot of people. If you could say, this is probably the one thing I want you to do today to help improve your sleep, besides the other recommendations, what would be the one thing you would want to tell our audience, do this today to get the best bang for your buck in terms of sleep quality? What would that be?
Well, if you can and society lets you do it, is to get on a schedule.
Mm-hmm.
Get on a strict schedule. Don't alter that schedule unless you have to.
Mm-hmm.
And that schedule, like I say, the two strongest things that set your body's clock are part of that schedule. And if you get those two things down, the time that you get out of bed in the morning and the time that you go to bed, because the second strongest happens about an hour before you go to bed, get those on a strict schedule and just get your circadian rhythm set. That is the number one thing you can do to improve your sleep quality.
Well, Dr. Rose, this is a great conversation. I think this will be a great benefit for our patients. If someone is interested in improving their sleep, talking to you, getting more information on that, what is the best way for them to contact you?
So my clinic's here in Lubbock, Texas. You can look me up in the phone book, or I don't know, you may have phone books anymore. You can look me up on that World Wide Web thing. My phone number is 806-791-3999, or you can have your physician refer you into the clinic. Some insurances require physician referrals, but...
And we'll put that information in our description, so anyone who has any questions or wants to make an appointment with you, they can certainly do that. Well, thank you for your time. It was a great conversation. I think I learned a lot for myself and my patients, and I'm positive that our audience did as well. So appreciate your time. Thank you.
Very good. Thank you.
Mm-hmm.